Hi, I'm Dr. Scott Pello, a neurologist with Excelsia Injury Care Center, and this March we're celebrating Brain Injury Awareness Month. A traumatic brain injury is really any injury to the brain caused by damage from an external force, and typically that would result in alteration of your normal brain function. That could either be blunt force trauma, where the brain is actually struck, or by a rapid acceleration or deceleration type injury, such as we see with car accidents where someone's involved in a whiplash injury, where the contents of the brain are jerked forward, then back, causing a shearing effect or damage to the brain tissue itself. Some common signs or symptoms of brain injury that people often overlook are more subtle changes. They're non-specific, they can appear more gradually. People know right away if you're having headaches or dizziness. But some of these other symptoms, such as changes in cognition with memory loss, word finding, trouble focusing or concentrating, or just feeling generally foggy, as well as mood changes, anxiety, irritability, or something called emotional lability, where really your mood's all over the place. One minute you're calm, the next minute you're agitated. Those are some kinds of signs and symptoms that people often overlook and don't take seriously right away, unfortunately. So it's important to be evaluated by a neurologist after a head injury, even if the signs or symptoms are mild at first, because symptoms can have a delayed onset. Sometimes things that we think are obvious, headaches, dizziness, ringing in the ears, they may not start for a little bit of period of time until after the injury. Small injuries can worsen. One of the most concerning things a neurologist would look for is there a small intracranial brain bleed that we have to address right away. Also, other neurologic disorders can emerge, such as seizures or other cognitive changes, and even a disorder called post-concussive syndrome. The neurologist's role when it comes to diagnosing and treating traumatic brain injuries is really to evaluate how the brain is affected structurally and also functionally. We want to identify any hidden or delayed complications, and ultimately, we're here to manage symptoms, prevent secondary injury, such as swelling of the brain or bleeding into the brain. And we want to start medication management early if necessary, for seizure prevention, for things such as sleep disorders, or even pain management. Lastly, it's important to have the neurologist start the rehab planning early. Start physical or occupational therapy, as well as cognitive or speech therapy sooner. It's always going to work out better. Well, I'm often asked, what's the most rewarding thing about helping patients recover from brain injuries? And I would say that when you look at people who've suffered a traumatic brain injury, oftentimes it's a very unsettling process. The people can be anxious, frustrated, or scared. It really shakes their confidence, and I've been told many times that people feel like they're losing their identity. So when you provide reassurance and give them the proper tools to get better and succeed, you're just so happy for people to see them get their life back, and it's unbelievably rewarding as a provider to see someone make that next step. Something small in life that people can do to help protect their brain and prevent traumatic brain injury is just reduce your risk by practicing everyday simple, safe measures. For example, when playing contact sports, always wear a helmet. When skateboarding, biking, or other recreational activities such as riding ATVs, put a helmet on. The message really isn't about not doing things in life that you like to do. We want people to be out there living their life to the fullest extent, but and not live in fear. If you just make small, consistent choices to keep yourself safe, you'll do your best to prevent having any brain injury and protect your brain in everyday life.